Um, Other thoughts on this issue of vaccine, which is really probably one of the more sort of hot topics right now in the United States as we talk today. And Risha, thoughts? I know you've thought about this a lot.
Yeah, so I'm just so glad Julius brought up the point about kind of this equity and access issue because, hesitancy is real. And, there were a lot of surveys before the vaccines actually came out suggesting that, African Americans and other people of color might have more distrust or be hesitant. And that's real. And I don't want to minimize that. But I think what we've seen as people, one, see the disproportionate impact that COVID has had in Black communities and kind of the death rates. But then also as vaccines have rolled out and people know other people that have gotten them, I think hesitancy has very much become less of an issue, and that access and equity has become more of an issue. And so I think we have to think about those things. I think the other issue around hesitancy, what we've seen in a lot of the community forums that we've done, and I've done a lot of speaking with a lot of African American-based, community-based organizations and other community groups, is that people had legitimate questions that they wanted answered. But when they had those questions answered, they were ready to get the vaccine. They just wanted their questions answered about, what was this mRNA technology? Kind of how did it work? Talk to them about how fast it was developed. This was named Operation Warp Speed. And that conveyed to some people that steps were missed. And so people just had questions, but as we've talked to people, we've had people then say, okay, I'm ready to get the vaccine. Where do I get it? But then could not get the vaccine because of the cumbersome systems that we've developed